This is a story of Muhammad, a typical story of someone who is sick and went to the emergency room for medical checkup. The doctor examined Muhammad and later on ordered for lab investigations.
Assalamu alaikum. I am calling from hematology. I want to relay a critical value.
وعليكم السلام ورحمة الله وبركاته. Yes, I am Dr. Murad.
Doctor, I have a critical value for patient Muhammad Siraj Ahmed Abdulaziz. You are in number 00005248. The critical result is hemoglobin 6 mg per deciliter. Can you read back, please?
Critical value for the patient Muhammad Siraj Ahmed Abdulaziz. The URN number C405248. The result hemoglobin is 6. Okay. Can I have your name and your ID, please?
My name is Muhammad. ID M1355. May I have your name and ID?
My name is Dr. Murad. My ID is MO347.
Thank you, doctor.
Welcome.
Few minutes since his blood extraction, the next thing Muhammad knew is that he already had a result, and according to it, he has to be admitted as explained by the doctor. Because of the hemoglobin result is of critical value, the doctor has to order for blood transfusion.
Hello. Assalamu alaikum, sister.
Hello, alaikum salam.
I am Dr. Murad from the ER. I want to request stat cross-matching for 2 units of packed RBCs for the patient Muhammad Siraj Ahmed Abdulaziz. I will send the nurse now with the cross-matching sample for the blood bank now.
Okay, doctor. I will inform the ER as soon as the blood is ready for issue. Hello, doctor. I'm calling from blood bank. I just want to inform that the packed RBC of patient Muhammad Siraj Ahmad Abdulaziz is ready for issue. Thank you. Then Muhammad started to wonder and question himself about what exactly happened to his blood sample in the lab. Like any other patient, Muhammad is not aware of what is going on in the laboratory and what exactly the people inside are doing. The laboratory from outside may seem to be just like a tip of an iceberg. However, behind it, there are a lot of things going on. Different sections, processes, and of course, the unseen healthcare heroes who are disguised in lab coats. They are the laboratory professionals, or commonly known as lab technicians, technologists, specialists, phlebotomists, and pathologists. They draw, mix, process, run tests, examine and observe, cut tissues, measure and analyze, identify and classify. They not only provide information, they give hope. Wherever accurate medical information is crucial to the patient outcome, they are there. And because of their effort, patient can receive proper diagnosis, medication, and the answer they needed. In Security Forces Hospital in Makkah, they are committed to provide reliable and comprehensive diagnostic services in a timely manner according to the best quality standard that ensure patient safety. At Security Forces Hospital Makkah Laboratory, this is how they deal with day-to-day battle while dealing with biological specimens in order to aid in patients' diagnosis, treatment, and prevention of diseases. Chemistry and Hormone Unit provides routine and specialized biochemical analysis of patient blood sample and body fluids using a highly automated analyzer. The tests performed includes glucose, BUN, CREA, electrolytes, liver function test, cardiac markers, hormones, drug tests, and many others. Blood Bank Unit is a laboratory division where blood collection, testing, blood component separation, and blood storage is taking place. It is a cornerstone of emergency and surgical medicine since it plays a very important role of ensuring a constant supply of usable and compatible blood for use in transfusion and other medical procedure. In Hematology Unit, it is where laboratory tests for the assessment of blood formation and blood disorders are performed, such as the complete blood count, platelet count, and many more. Like any other unit in the lab, upon receiving of the specimen, the technologist inspect for its condition. In case of any rejection criteria is observed, like clotted blood, the technologist promptly call for sample rejection. Anatomic pathology is composed of two main divisions, histopathology and cytopathology. The main specimens are tissue biopsies and body fluid cytology. Before a pathologist can determine whether a tissue is normal, tumorous, or inflammatory, the sample has to undergo several stages of preparations. The steps start with grossing, fixing, processing the tissue, embedding, sectioning, staining, and lastly, microscopy. Serology is an area in the lab that performs diagnostic testing for the detection of infectious diseases and assessment of the immune system. The test performed includes HIV, hepatitis profile, and many other immunologic tests. Microbiology is where urine, stool, sputum, swab samples, and other biological specimens are being processed. Generally, samples in microbiology are planted in a growth medium that designs to allow bacteria that causes infection to grow so that the microbiologist will be able to identify not only the type of the organism present, but also the type of antibiotic that can be used to cure the infection. After completed his hospital treatment, Muhammad was discharged. In the field of healthcare, all caregivers are superheroes in their own way. Some heroes wear stethoscope and scrub suits, while others may spend less time with the patient but are working under the same goal, which is to provide the best service to the patient. And in every successful stories of patient journey from treatment to recovery, they are part of it. As we celebrate the Laboratory International Day, let us acknowledge the heroes behind the scene. The laboratory professionals of Security Forces Hospital Makkah.